So here we have a further demonstration for the triceps surae. Again, we're just going to demonstrate wrapping the Achilles tendon portion. However, depending on the symptoms that you feel, depending on the symptoms that the patient presents with, if you're a practitioner, will dictate where you may want to place the flossing tape. Just because the tape is demonstrated here in the distal portion of the lower limb doesn't necessarily mean to say it must always be applied here. It may be applied in the lower aspect, it may be applied in the upper aspect, or it may even be applied in both. It is entirely down to the symptoms that you feel and your own clinical rationale. All we will move on to later in this short clip is how to add another type of stretch into this area that may be different from the standing stretch, focusing slightly more on the soleus, and how to mobilise the ankle in this position with floss. So an alternative stretch we have here is the kneeling calf stretch, which with a bent knee will place slightly more focus onto the soleus muscle. And you can see again we're using this cyclic action, pulsing on and off the stretch, or we can hold it at end range for 20 to 30 seconds. And adding in an aspect of ankle mobility to this workshop, we can then add in a little bit of an external weight here as a small kettlebell, and we're just allowing that to take the knee over the toes with a little bit more weight to take us into that end range, flossing and mobilising the ankle and the soft tissues at the same time.